Phases of cannabis regulation and the reality of global trade. That last part of the sentence is the most important, the reality of global trade. So welcome, Bob, and thank you very much.
Good morning, everybody. Yes, as the title indicates, let's talk a little bit about the phases of regulation. What are some common themes? And these are observations that I had over the years working in. I worked in about 35 jurisdictions around the world. Many times engaged directly by the government, oftentimes working for a client that has access to the government. So sort of putting together ideas and solutions is always an exciting opportunity. And when you sit down with the government, by the way, you try to ask them what their objectives are, and they don't really know, and it's not a knock on the government. It's really, really hard for them to understand how they want their program to look. So you have to begin by identifying countries that they align with, countries that they don't align with. For example, is there a neighboring country that politically or historically or culturally there's misalignment? So you don't want to suggest an alignment that works or a framework that works in that jurisdiction with a jurisdiction that they're not necessarily compatible with. So starting with this notion that there is no such thing as a perfect cannabis framework. Let me give you an example of that. I worked for the government of Morocco for more or less 4 years, helping them write the law, then helping them trying to eliminate some barriers to enter the international marketplace, and then ultimately trying to help them create a semblance of a marketplace, a balance in the marketplace. And my approach is what I call the 60% approach. What does 60% mean? So 60% is the 100% legality that Morocco cares about. Hear me out here. So you take a cannabis farm in Morocco and you create a bunch of hashish. Then you take this hashish and you have it sitting and it has an opportunity to go into traditional channels, underground, illicit channels for lack of a better way to put it, or you can take that kilo of hashish and you can put it on top of the table and you can create a landing spot for it in a jurisdiction that works. So I've got, in this example with Morocco, I've got a legal farmer who's registered. I've got a product that was produced legally, maybe not always up to the standards that are required internationally, but I've got a product that's legal. How can I get it to the ultimate recipient? And I'm talking about it from a supply chain perspective, whether it's a patient or someone that can purchase it because they're 21 years or older. How do I get it from the farmer to that recipient? I would suggest very strongly that you can't create a 100% legal transaction from that Moroccan farmer all the way to that recipient on the other end. But what you can do is make the part that Morocco cares about in this example 100% legal. So follow me here. Legal farmer, legal hashish, sits at the border, lands in a distribution company, a distro, in say Greece or Spain or Portugal or Czech Republic. Maybe even there's a way to GMP wash or GACP wash the material, meaning get it a certification after the fact, even though it wasn't produced at that level when it was produced. So from Morocco to the distro, 100% legal transaction. That's only 60% of that transaction. From the farmer to the distribution company, how does it end up in the consumer's hands, whether that consumer is a patient or in certain jurisdictions simply allowed to possess cannabis because of being a certain age? That's the question. So does Morocco care about what happens after it leaves the distributor in this context? Well, it should. It should put processes in place to ensure that that cannabis that was produced and ultimately landed at that distributor is legal and up to the right standards, but that takes time. So you can't let perfection stand in the way of progress. Sometimes I hear, and I heard some of the frustration in the room yesterday with the government. The government's not helping us do this, or the government's holding us back from this. And I would encourage you to really sharpen that point in that thinking, because at the end of the day, the government doesn't have experience creating brand new markets. It doesn't. It has experience in restricting and regulating things oftentimes. So if you put the burden on the government to create a new framework for you, it's oftentimes going to fail because there's no market experience behind the government. So you have to be really pointed. And an interesting thing that I want to focus on here is that the cannabis industry, what really is it? We say the cannabis industry, we say let's legalize cannabis, but what really is it? Because on one hand it's medicine, right? On the other hand it's agriculture. On the other hand it's, say, consumer packaged goods, it's maybe durable goods. When you think about the uses of hemp, when you think about the uses of plastics and fuel, it's also composite and enters other different industries. It's a food and wellness product when you think about the omega-3s, the protein in the plant. It's a superfood. It's a pharmaceutical when used as a ingredient in a formulation that's approved by an FDA equivalent body around the world. It's a manufacturing tool. It involves international trade. It involves public health. It involves criminal justice. So my point to you is when somebody says, let's legalize cannabis, or I won't be satisfied until we legalize cannabis, what do you mean? Because legalizing cannabis has all these different ripple effects and these connotations. If I'm an attorney or a consultant and I have a client in a particular field, and that client wants to sell adult use or medical cannabis, or maybe that client wants to produce fuel from hemp, similar to the Henry Ford ethanol from back in the day. What industry are they operating within? Because as lawyers and consultants, it's one thing for us to be very good on the technical merits. That's a given, though. People don't come to us as lawyers and consultants, et cetera, unless they know that we know our trade. But I think it's that magic, that secret sauce when you can understand the industry, how you understand how the industry connects as well. That's where you can add the most value. But if somebody says to you, what is a measure of success for legalization? I just want you to think a little bit more deeply and think about it by saying, well, legalization touches so many different industries, and those industries and those existing regulations and those existing rules, those are the things that I need to be concerned about because my client or the operator or the entrepreneur is going out and stepping into a field that, to be honest with you, never really existed before as a commercial matter. I mean, people have been using cannabis for thousands and thousands and thousands of years. But at the end of the day, to create a commercial trade from it, to take what was under the table in the shade and bring it above the table and create and impose standards, those are some of the really, really challenging things. Now, one of the other observations I have is when you have a new market legalization, you can't just have an export-only marketplace. You have to have some sort of balance. Now, a lot of countries come out and they say, well, it's good enough for us to produce it and export. Take Colombia as an example. Colombia doesn't necessarily have a domestic distribution program, but several years ago, it issued a number of licenses and started to export flower. Because of the rise and fall of markets, that market expanded, it shrunk, and it's probably right where it needs to be today. But at the end of the day, Colombia can't continue to survive as a country by just exporting cannabis. You have to have some sort of balance. You have to have some semblance of domestic distribution to create something that works from a market model. Whether that's CBD, whether that's medical cannabis in its broadest form, or something different than that. So the whole point being is you need to eliminate the asymmetry. You can't just have an export-only market. Now, I know South Africa in particular is very strong, at least reputationally right now, in terms of its exports into the different markets. But how do you turn that and balance that, not just with the club, went to a wonderful club last night here, and the scene is really, really cool and really, really interesting, but how can you continue to look at 100% legal exports and these local elements of business that sort of operate in a little bit of the gray area And as lawyers, how do we advise our clients accordingly? So that's one of the takeaways that I've always noticed is that imbalance, that asymmetry creates public policy problems. Follow me there? Anybody have any questions about that kind of stuff? And please raise your hand on any of this stuff because I'd love to have this be more interactive if anybody has a thought along the way. So, yes, sir.
Well, you have to start with the casual use of misuse of legalese about the legalization project, because it doesn't sit. It's not easy for me to explain like this, but the legality of, as you refer to, of cannabis doesn't exist, or the illegality of cannabis doesn't exist. And those words have to be used precisely by lawyers. So what can be legal is what we're doing with cannabis, or what can be illegal is what we're doing with cannabis. But the cannabis remains neutral as cannabis. It never is legal, illegal, or legalized.
Well, so ultimately, the government would believe, and most governments are going to have the right to regulate public health and safety. And
Right.
that the issue of public health has become a huge issue where the government has expanded its rights and powers over the years. I guess its powers, perhaps unilaterally. But at the end of the day, if you've got a plant and that plant is regulated also by international treaties, then it effectively makes it an illegal product for us to possess on a regular
What's
basis.
being regulated is
Yes, sir.
ourselves. Our endocannabinoid system is what's the subject of regulation. And we regulate human activities about the plant. Every activity with the plant is a human transaction. That's what we're regulating. And effectively, we behave illegally, not the plant.
Well, that's true. I don't know how the plant could behave illegally, but we ultimately are the ones that are getting the finger pointed at us. It's a really good perspective. But let me zoom out a little bit here and sort of get myself back on track. There's also three phases of regulation that I see in different countries. The first phase, you start with that framework, right? How do I create the ability for farmers and processors to get a license to operate legally? That's step one. Once that happens, then you've got the opportunity to create an industry around that. But that takes years to unfold. It's legal, I can put plants in the ground, I can harvest those plants, I can package those plants. But what about the next phase, which is eliminating barriers to market entry, whether that's a domestic marketplace or for export? How do I eliminate those barriers? That is the most significant phase of commercial industry developed public policy-wise from country to country. Because if I create a framework and farmers can produce legally, it doesn't mean they can automatically sell their wares into the international marketplace. It doesn't mean that they have the standards in place that ultimately allow those products to be sold in a medical marijuana market, for example, like Germany. So it's ultimately assessing that. It starts with genetics. It starts with practices on the ground. It starts with testing. It starts with having the GACP for plant material and flowers, or GMP, or EU GMP for manufactured goods. So ultimately, that's phase two. That's a really difficult phase, and you get caught up in there for years, even if you have good regulations. Then phase three tends to be creation of that domestic marketplace, because a lot of countries, they don't think they want it to begin with. They want to be able to export. They want to be able to send things out the door, but they don't want to have that domestic distribution. So sort of having that balance and viewing things through those three lenses, we'll realize that you don't need anything perfect at the beginning. Because even if you create something that's quote unquote perfect on paper, it's going to run into that roadblock, which is phase two, which is the barriers to market entry. The government can't fix that. The government can help grease the skids. Let me give you some examples of ways we've done that in different countries, or at least the ways that as a consultant we've recommended that they address that. We take those early days of a program and we say, retroactively grant legality to product that may have been produced outside of that legal system. Doesn't mean that the product is going to pass international standards to enter into commerce, but if I can clean up what already exists through these waivers, then I take one step towards eliminating those barriers to entry. But that is a period of time that lasts for years. So even if you get to the perfect model where you have this symmetry, you've got an export market, you've got a domestic market, and it all flows nicely, you're still trying to eliminate the barriers to enter the international commerce and trying to create a domestic marketplace that complies with UN treaties and otherwise. So everyone follow me on sort of that concept? All right, so then you've got this other notion of legitimization. We talked a little bit about this yesterday when we talked about stigma. Even if you have the law in place, even if you have businesses that are operating, how do you eliminate the stigma? How do the business operators eliminate the stigma such that they can be treated like any other business instead of being treated like a business that sells drugs or narcotics or the like, even though ultimately that's the perspective of the regulators that are involved. And legitimizing that, reducing the risk, and creating more of this harmony with the way other businesses operate, that's really a critical element in the evolution of this. I believe did you have a question out there, sir?
You addressed it, thanks, Bob.
Thank you. So ultimately as well, I want to make this distinction between regulations and legislation. Again, when we're striving for perfection, we want this perfect bill and legislation. We want the bill to contemplate everything. We want it to regulate all the different pieces and provide answers to all the different areas. But at the end of the day, the law is just the framework. The law is the more difficult thing to get in place, which is why when we talked yesterday, I said always take the law, even if it's not perfect, because you can fix it with regulations. And I want to make this hard distinction. And legal systems around the world are not all the same, but I make a huge distinction between the regulations and legislation. If you violate a law, a statute, you're operating illegally. If you violate a regulation, you're simply not in compliance. That's not an illegal act in most places. Now, the penalties can be severe, and the penalties can be on par with the violation of a statute, but ultimately, regulations are the beauty of this industry because we can change regulations through regulatory action, through rulemaking, through a process, and we can pivot. For example, when we see that let's say we put a 10 or 15 milligram limit on edibles that are served over the counter in a certain jurisdiction, and we realize that that's being abused, or there's inconsistency, or people are consuming high potency edibles and it's causing an effect. Where there's some stories in the public. The government can go in very quickly, in a matter of days, and change those regulations to modify that either on a temporary emergency basis or on a permanent basis. So my point is that distinction between regulations and legality is very, very, very important because the absence of prohibition creates legality. The absence of regulations has no bearing on legality. That's the government's responsibility and the agency's responsibility for not moving quickly enough. Unless one thing happens. The statute says you can't operate as an industry until there's regulations in place. And the statutes never say that. The statute says this is legal. So why do we wait for regulations to be created when ultimately the absence of regulations is probably what creates the market opportunity? But then again, I know legal systems are different all over the world. I know that the penalties and repercussions for violating a regulation in a place like South Africa, the European Union, for example, the sanctions and repercussions can be as severe as violating a statute. But I urge you to think of those things very differently in that regard. Let's talk about the global trade reality. We've got reciprocity over uniformity. We don't have uniformity, right? If I grow cannabis in South Africa and I want to ship it into Europe, I can do that. But I have to figure out how each country's import rules exist and operate. I need to figure out what paperwork I need from the sending or delivering jurisdiction, the exporter, to receive it into a particular country. And it's not the same in every single transaction. So looking at this notion that we need sort of identical regulations across the board, not necessarily so. If regulations were easy and if everything was uniform across the board, it would eliminate opportunities for people that understood how to navigate the complexity of operating in multiple countries at the same time. If it was easy to do and everything was uniform, then big players would dominate the space, and we just haven't seen that yet. So ultimately, the global trade reality is something that I find really, really fascinating. The fact that I can take product grown here in South Africa and I can ship it into Europe, into a recipient destination there that ultimately distributes it and regulates it and creates an entirely new paradigm under a medical regime. The other thing that I think is fascinating is everybody has different perspectives on whether cannabis should be legalized for adult use, for medical purposes, whether hemp even has a place in this, or whether it should just be one uniform standard. But I would urge you to think from a supply chain perspective. We all have our different angle on why we participate in this industry, and whether it's medical, whether it's just adult use, or just public policy and criminal justice reform. I like the notion of thinking of it as a supply chain, because that cannabis that starts up there, it's going to end up in one of multiple different channels. It will end up potentially in a medical channel. It could potentially end up, as laws evolve, in an adult use channel. And ultimately, with the United States moving to Schedule 3, we have no idea how this is really going to play out. There's many international operators all over the world that are really, really strong in producing high quality product, shipping product into places with a lot of consumers like Germany. But ultimately, the paradigm is going to shift. You've got California cannabis that's going to enter the international marketplace, and it's going to shake things up dramatically. But I would suggest very strongly that the opposite is true as well. If you're licensed, for example, in a place like South Africa with a national license, you could qualify to register with the DEA or whatever paradigm ultimately does get adopted by our federal government in the United States to do the exact same thing here. My point being is it's all connected. The supply chain is all connected. Whether that plant material is ultimately being used to extract cannabinoids for formulations that go into a strictly pharmaceutical blend, or whether it's being used to formulate, the sale of flowers over the counter. It's something to really pay attention to. And who thought this, by the way, that the medical system would be based around not formulations or magistral compounds or the like at this point in time. It's based on the prescription of flower. How odd is that? How odd is that we put the burden on a doctor to say, Mr. Hoban, you look like you need 2.5 grams a day because that helps with X or Y or Z. How does that make any sense? How does a doctor, how does a licensed physician tell me how many grams I could have instead of telling me what I should take, how I should take it, so forth and so on? We have imperfections in the system. So my whole point in telling you this is that there's a patchwork of laws, regulations, and challenges that await. There is no uniform, perfect way to do this. There is no perfect solution. It's going to take time. It's going to take various iterations, and you need to be flexible. But the beauty of it is, as lawyers and as consultants or people that advise people operating in the space, we get to help figure it out. We get to learn through this process as well. And the beauty of is that you have this network to rely on all around you, myself, everyone in this room, and by extension, our individual networks, to pull this information in, to help get you over the finish line, to say what's happening here, how can we fix this, or how can we change this, because the problems are all very, very similar over time. Yes, sir, you had a question back there.
Yes. So this is going to relate back to, I think, language, as well as the example that you used. The 2 grams for elements. So I think the one thing we also tend to forget about this plant is that it's indigenous. So we have, the language, we have the legalese, the regulations, etc. But the place where it births from is from indigenous plant systems. So they don't understand the limitations that have been put on humanity on the plant. So the 2 grams that I may give you, I know for a fact from the indigenous knowledge systems, it will be X. That's like a powder that I'm grinding, the seeds that I'm giving, etc. Which I think also adds extra complexity when we're trying to involve indigenous people into the conversation, because again, with that asymmetrical sort of thinking that you brought in, that's where we clash. Because as an ideology, we want to create frameworks and all these things, but once we incorporate the indigenous, it's sort of opposite, you know, and we're going by feeling, spiritual guidance. This is the vibe, you know, but wait, the regulation doesn't speak to that. We speak to one, you know. So I think at some point we have to also realize that they have to be in the room so that we can actually create framework that actually speaks to everyone.
Excellent, excellent point. Did everyone catch that about the importance of involving indigenous folks? So, Sita.
Yeah, I would like to respond to that because basically we have also for that regulation, which is the Kyoto Protocol. And I can just everybody warn to ignore it because in Germany we had the first scientific papers which have been withdrawn, which means a year long of science is dismissed because they could not prove that the seeds that they have been used are, according to the Kyoto Protocol, registered and exchanged with indigenous people. So that if you tell, I don't know if everybody is aware about the Kyoto Protocol. This is a treaty which is avoiding that indigenous communities are exploited by taking away their genetic value and then just taken away and done something and they do not benefit from it. So for that, the Kyoto Protocol has been established, and so that means that these people will have a fair compensation. And
So-
you just can tell everybody to do it at the very beginning. Also in fairness, and also, to be honest, in commercial development, so that you are then not ruined because somebody is raising their hand, but at the beginning to sit together and to have a fair exchange on that, give a percentage, whatever, like a royalty, like you would do with any other commercial partner. And if you can prove that, because as we are saying, okay, you can talk about adult and recreational use, but we see a big shift into the pharmaceutical one. We have our members are developing pharmaceuticals, and in that way, I just can say that they have to be aware that this is put in place, otherwise scientific work of fields will be dismissed.
So generally speaking, there's ways to deal with this by virtue of the Kyoto Protocol standards, et cetera. But I would also note that some countries, for example, the indigenous problems differ from country to country. I mean, Morocco legalized cannabis because it was the indigenous population in the Rif area in the Atlas Mountains that was growing 60,000 hectares of cannabis a year. So the problem was not helping, it was helping them become part of society, integrating that population culturally, and no longer outlawing the work and what they did. But here's an interesting one, and one of the last points I'll make because we have run out of time here, is countries have allowed indigenous folks to register their genetics without a fee oftentimes, and before any commercial enterprises can come in, and they can say, these are the genetics we've used in this region for X number of years, and they register those, and that becomes the property of that group, of that tribe, et cetera. And I think that that's an important thing because ultimately it is the genetics that is the key to so much of this industry. The land race, the history, everything associated with that is so critically important as well. But to be able to protect those and have other people not come in and steal it and commercialize it, I think is a really, really easy first step that a government can put in place. So one more question before we call it and move on to the next one. Yes.
So, sorry, it was the Nagoya Protocol, Kyoto relates to climate change goals.
Yeah, you're right.
So there is of course the duty of care as well to not use indigenous communities as a marketing tool, which we are seeing a lot in South Africa as well, where people are claiming to be supporting indigenous and traditional communities and their knowledge systems. But like we see with harm reduction as well, it's used as a marketing hashtag more than anything else. So where is the duty of care really in ensuring that we are following through with that? Because like in South Africa, regulations don't really state that we have to do it. It's legal for a fee. You pay a fine and you carry on. So how do we actually protect the communities correctly in that and really make sure that benefit sharing goes where it belongs?
This becomes a whole nother conversation. But let me just say this. There's this notion of social equity and putting social equity related provisions, programs, et cetera, attached to a law to help disadvantaged or poorly treated populations over time as it relates to drug reform. It doesn't always work. It's a good measure and it's a good effort, but it doesn't work, and I feel like it creates more exploitation of the people that qualify under social equity. As a lawyer, I can't tell you how many times over the years someone says, hey, this is my friend and they qualify as a social equity applicant for whatever reason. Maybe they were incarcerated previously or whatever. They're going to get us our license, so we need you to craft a structure for the business where they have ownership that's majority as required, but they don't have control, for example. So people get exploited, but there are ways to do it, and I think fairly, and only that will evolve over time. But thank you guys so much for your attention this morning and coming out. And, really, really a pleasure to be here. Thank you.